In this video, we'll be discussing some measures that you can use to help you reduce your blood pressure, because having diabetes places you at an increased risk for developing high blood pressure. And having high blood pressure and diabetes can increase your risk for having a heart attack or stroke. Therefore, it's important that we take steps to minimize our risk. Having diabetes is not the only risk factor. There are other risk factors out there. Some of these risk factors we can control, and other risk factors we can't control. Risk factors that we can't control are things like our age, our genetics, and our ethnicity. Making diet and lifestyle changes can help to reduce our risk for developing high blood pressure, because these are risk factors that we do have control over. So look to cut back on salt in your diet. If you're overweight, look to lose weight. If you lead a sedentary lifestyle, try to increase your activity levels. If you drink alcohol in moderation. If you smoke, look to quit smoking and try to manage the stress in your life. It is recommended that we consume no more than 6 grams of salt per day. Sadly, many of us in the UK are consuming more than the recommended 6 grams a day, with a third of us doing that. So where is the salt in our diet coming from? 75% is coming from commonly consumed foods. What are these foods, you might ask? Takeaways and ready-made meals, snacks like nuts and crisps, tin food, processed meats, condiments and sauces like ketchup, and even foods that don't taste salty can be high in salt, like cereals and breads. When opting for ready-made meals, try to read your food labels, as this will help you identify products that are lower in salt. For nuts, look for unsalted varieties. For tinned products, look for products that are in spring water as opposed to brine. Limit your intake of processed meats. For condiments and sauces, look out for reduced sugar and low salt options. And compare products and compare different cereals and breads with other household brands. You may just be surprised at how their salt content differs. So tips to reduce your salt intake. The single most important thing that we can do to help reduce the salt in our diet is to read food labels. Nowadays, a lot of food products have a nice traffic light system on them. This helps us to identify products that are high in salt and can be used to compare products and help us select products that are lower in salt. We should be aiming to purchase more green and amber products and trying to limit our intake of products with red labels. Another 10% of the salt in our diet comes from cooking and what we add at the dinner table. So try to keep salt away from the dinner table. We often use salt to flavor our food, so look for other ways to flavor your food, such as using fresh herbs and spices, chili, garlic, or using some lemon or lime. Although they're often promoted as being natural and healthier, your more expensive salts out there like pink salt, rock salt, sea salt, and Himalayan salt are no different to your normal salt. Salt substitutes are also not advised. This is because the salt has often been replaced with potassium. And if you have kidney problems, this can be dangerous. So it is always advisable that you check with your healthcare professional before using one of these salt substitutes. And remember, takeaways, fast food, and processed foods are high in salt. So try to limit your intake of these foods.